Doctor, what kind of pillow is best for me? This is a question that I get all the time. Do you ever crawl into bed hoping for relief only to wake up feeling like a pretzel? You're not alone. In the next few minutes, you're going to learn some simple steps that you can take to tweak how you sleep and potentially transform your nights to wake up feeling good as it relates to your spine. Hi, I'm Dr. Deeptee Jain, and I'm a board-certified orthopedic spine surgeon. And here, subscribers turn here for back care advice that they can turn into practical habits. So let's get ready to make sleep your secret spine weapon, and let's dive in. Whether you're on your back or your side, the number one thing about a good spine pillow and in general good sleep habits is how it relates to keeping your spine in a neutral position. That includes your ears, your shoulders, your hips that are stacked in a straight line. Anything that kinks that line in one way or another is really going to abnormally load your discs and your joints in your spine, and that's going to create pain. So that's tip number one, keep your spine neutral. Tip number two is to match your pillow height to your position. So it depends on the way you sleep, but again, the same concept applies. You want your spine from head to toe to be in a neutral position. So for back sleepers, a medium loft pillow can keep the chin from lifting up or down. But really, you're going to have to assess what works with your body habit as the best. Side sleepers, you want a firm, thicker pillow that really fills that gap between the ear and the mattress so that the neck doesn't sag down and your head isn't up like this. Stomach sleepers, well, we're going to skip ahead in a little bit. I'm going to talk about stomach sleeping and why that's probably not the best, especially for your cervical spine. Next tip, tip number three, a firmer mattress. There are studies that compare firm, medium firm, and plush mattresses consistently. In general, these demonstrate that medium firm can potentially be the best type of mattress for reducing pain. It supports the lumbar curve, but yet cushions pressure points so that muscles can truly relax. The reality is when it comes to mattresses, there's no right, there's no wrong. You are going to have to assess what works for your body and what doesn't, but that at least might be a good place to start. Side sleeping. If you're a side sleeper, you can use a knee pillow hack. So when you sleep on your side, the top leg pulls the spine into rotation. So if you put a pillow in between your knees, that can actually keep your hips level and therefore keep your joints and your discs happy. It also stops the knee-on-knee pressure that can sometimes wake you up. Tip number 5. Why stomach sleeping sabotages your spine. So when you're sleeping on your stomach, you can imagine you really have to rotate your neck substantially in one way or the other for a long period of time. This can result in abnormal loading of both your neck joints as well as the discs in your joint and in your neck, and both of these things can really exacerbate neck pain. I'm sure all of us have woken up one day with like a big crank in the neck, and this can potentially contribute to that. Tip number 6, pre-sleep mobility routine. Think of it as brushing your teeth, but for your vertebra. So 2 minutes of light mobility unloads the discs, boosts fluid exchange, and primes the muscles for deep recovery mode. Finally, tip number 7, the log roll morning exit. You can imagine that if you just all of a sudden get out of bed and sit up straight, first thing in the morning, that's going to result in some pain. Discs are more hydrated and vulnerable first thing in the morning. And also, our muscles aren't necessarily primed. The muscles are really key dynamic stabilizers to the spine. So if they're not really ready to go, that spine is going to see extra load. So instead, try rolling off to your side, let your legs down, and then push up. It's a very quick 5-second habit that might prevent the first knife in the back type feeling when you get up in the morning. So key takeaways: neutral spine alignment, pillow to sleep style, a medium firm mattress, knee pillow for side sleepers, ditch the stomach sleeping, 2-minute mobility before bedtime, and a log roll exit. Okay, that's taking you from beginning to end. And keep in mind, you're going to have to do some trial and error to see what works for you best. Remember, your mattress and pillow are like equipment. Set them up like an athlete would. Small nightly choices compound into healthier spines and potentially pain-free mornings. So if you're ready for a deep dive into pain-free living, hit subscribe and smash that like button. Have a burning sleep spine question? Drop it below, and let's get you resting easy.